Hi everyone, welcome to the webinar on Mobilizing for Vermont's Health. I'm Mike Palmer. Thanks for joining us. The agenda today is first we'll talk a little bit about our shared goal, and then we'll cover 5 ways in which the new budget law that went into effect on July 4 will have an impact on Vermont, Vermont's health, and Vermonters, and the Vermont economy. Then we'll tell the story of how Ellen Oxfeld, Jack Mayer, and I ultimately persuaded the Middlebury Selectboard to adopt the model resolution, which we will be sharing with you in this webinar as well. And then we'll share the vision for fulfilling Vermont's promise on universal health care. And finally, we'll talk a bit about the Roadmap for Action, which is a guidebook we've prepared to help local groups that you might form or might already be in existence put a resolution like the one we got the Middlebury Select Board to adopt before other select boards. So our goal is very simple. It's Vermont healthcare for all, everybody in and nobody out. The new budget law will have a 5-fold impact on Vermont's health and Vermont's economy. In the first instance, we have what a lot of people have heard about in the news and perhaps read about as well, which are the massive cuts to Medicaid that the budget law mandates. Over $1 trillion of funding will be taken out of the system, reduced, and not made available for the states. In addition, the new law requires people who are able to work to not only work, but document that they are employed. And this creates a major impediment to continuing insurance, which has been talked about because of the problems with completing the paperwork and making sure that all the systems work. In addition, there will be new eligibility requirements that reduce the number of people who can qualify for Medicaid. In Vermont, that amounts to a 13% reduction in the amount of money coming to Vermont for Medicaid. The Kaiser Family Foundation estimates that will result in a reduction of funding between $2 and $3 billion over a 10-year period of time. The second impact will be on Medicare. This has not been discussed very much or talked about a great deal in the press, but it is an effect of the pay-as-you-go law, which requires that whenever Congress adopts a budget that results in a major deficit like this one, automatic reductions have to be put in place for Medicare. And in this case, the Congressional Budget Office has estimated that the reductions in Medicare, which will begin immediately, will total $490 billion over 10 years. That will have a high impact on rural hospitals. It will also reduce coverage for low-income Vermonters. The third impact is on the Supplemental Nutrition Assistance Program, also known as food stamps. In this case, the program will be reduced by $290 billion. The program will also have expanded work requirements, and the result of both of these provisions will exacerbate health problems and lead to greater food insecurity, which not only is a problem for just getting through the day, but exacerbates the tendency to get sick. So the fourth impact, which has almost been talked about not at all, is the restriction on provider taxes. This is kind of in the weeds and wonky, but what it means is that Vermont and 21 other states, which rely on taxes on hospitals and clinics to provide funds for Medicaid will be required to reduce those taxes to 3.5% or less, and that will further jeopardize the ability of the state to provide Medicaid coverage for low-income Vermonters. The fifth impact is on higher insurance premiums. So under the Affordable Care Act, there is an exchange or marketplace where you can buy insurance. In Vermont, that's called Vermont Health Connect. And the Kaiser Family Foundation estimates that the premiums for those insurance purchased on those exchanges will increase by an average of $1,300. Young people will be paying much more than they are currently used to pay, and it will also result in higher copays with reduced quality of care. So that's 5 ways in which this new law will have a severe impact on Vermont's healthcare system and Vermont's economy. We should note that we are already in a precarious situation with our healthcare system in Vermont. Blue Cross Blue Shield has announced that it's teetering on bankruptcy and needs to boost its premium rate significantly, 23% for individuals, in order to stay in business. 4 rural hospitals are on the edge of closing. One, for example, in Morrisville, Copley Hospital, announced that it was considering closing its birthing center, and after this slide was created, it did in fact close its birthing center, which means that if you are pregnant in Morrisville and your water just broke, well, good luck getting to Burlington, which is the next hospital that would be available to you. And it's just going to have a really dramatic effect on people in the area served by Copley Hospital. So just to give you a brief overview of our situation with healthcare coverage and insurance, 400,000 Vermonters have adequate healthcare coverage in Vermont. And if you're one of them like me, be grateful for that. You're able to participate in the system without any hassles or large copays. But 250,000 Vermonters don't have really usable health insurance because their deductibles are so high that they don't go to the doctor for routine medical issues. They don't do preventive care, and they are paying for catastrophic health insurance, but they're paying a high price for it. And the system is paying because when they do get seriously ill, it becomes much more expensive to take care of them. So this is part of the problem that we have right now. With respect to Medicaid, Medicaid covers 168,000 children and adults in Vermont right now. And the way that breaks down is 37% of all births are covered by Medicaid, and 62% of nursing home residents are their residency is paid by Medicaid. 45,000 Vermonters could lose their coverage because of the new law that was just signed into law on July 4. So now we want to turn to the Middlebury story, and for that, we'll be listening to Jack Mayer. Okay, so now we want to talk about the Middlebury story, which is what Jack and Ellen and I did, along with many others, to help get the Middlebury Selectboard to adopt the resolution we've been talking about. So, Jack, go ahead.
Okay, thanks, Mike. So one of the things that I wanted to talk about was the first story that I told the select board in Middlebury about my own personal experience as a primary care pediatrician. And this happened when I was a fairly young doctor. I was working in a solo pediatric practice in eastern Franklin County on the Canadian border. And I had a call from a family that I took care of. They were concerned about their child who had been sick for a couple of days and was getting sicker. I told them they really needed to come in. I really needed to see them. This was a family that had no health insurance. They always paid their bills out of pocket, and they had delayed coming in for me to see their child. Child's name was Brian. When I finally saw him, he was desperately ill. He had meningitis. He survived the meningitis, but was permanently damaged both neurologically and cognitively. And if I had seen him 1 or 2 days before, none of this would have happened. We would have been able to intervene in time to have him cured of his meningitis and not have the after effects. And this really profoundly sensitized me to the problem of people with inadequate or no health insurance or inability to access primary care in a timely fashion. So in our efforts, in Mike and Ellen and my efforts to bring this resolution to the Select Board of Middlebury, we depended on data from the Vermont Department of Health and the Kaiser Family Foundation to look at what the impact of these Medicaid and SNAP cuts would be on Middlebury, on Addison County, and on Vermont, and to look at it through the prism of Vermont's healthcare crisis, which we are all now really aware of how acute the crisis is and how fragile our healthcare system is. We began this effort in April of 2025, so about 3 months ago, and it was an uphill struggle. It was difficult. The Select Board refused our request to add this resolution twice. Their concern was that this would be a, quote, slippery slope, unquote, and all sorts of other political and partisan resolutions would be introduced, and that didn't have anything to do with Middlebury per se. We convinced the Select Board finally that this was in the purview of the Select Board, that this directly affected Middlebury, Addison, and Addison County. Part of the effort to convince the Select Board was a letter that we obtained from Bob Ortmeyer, who is the president and chief operating officer of Porter Medical Center here in Middlebury, who detailed the extremely serious deficits that would be occurred that would be imposed on Porter Hospital and the consequences downstream of these budget cuts. We discussed the effects of this on the counseling service of Addison County, home health and hospice, not only Porter Hospital, but the Helen Porter Nursing Home and Rehabilitation Unit, on the Parent-Child Center. Porter is the largest employer in Addison County, and if we lost services, or if, worst case, the hospital was forced to close, it would have a devastating effect on both the health and the economy of Addison County. We pointed out that 4 out of Vermont's 14 hospitals, rural hospitals, are in danger of bankruptcy or closing or severely curtailing their services. And indeed, while we were having this conversation, Copley Hospital announced the closure of their birthing unit. When we finally were able to convince the Select Board, which we were able to do by our testimony, by the letters that we accumulated and presented to them, and by really filling the room where the Select Board was meeting with supporters of this, they were convinced of the importance of this resolution, and the resolution passed 6-0 with 1 abstention. So we felt this was a true validation of the importance of this resolution. And the resolution is not just limited to the effect on Middlebury and Addison County. Our hope and part of our resolution was to encourage use of this sort of resolution as leverage on our legislature, on our General Assembly, to highlight the problem. This is not partisan. We weren't speaking up for any particular bill or approach. We wanted to simply highlight and spotlight the dimensions of the problem. We also had a wonderful presentation by Wendy Baker, who is the superintendent of our local school board, talking about the impact of these budget cuts on the education budgets. This healthcare being the second largest expenditure for most school boards. So our hope is that this particular resolution can become a template for other select boards to emulate and to use in their particular way, either using our verbiage or adopting it to their own particular needs and interests, but to really highlight the crisis that we're in regarding healthcare, and to use this both in terms of our congressional delegation and our state legislature and General Assembly to further their legislative efforts to deal with the healthcare crisis that we are already experiencing, and that will be made dramatically and worse because of the consequences of the budget bill that was just passed. We have updated this resolution to reflect the new law, the budget bill that was passed, and we are happy to make this available to other individuals who would like to approach their select boards. And we're hoping that there will be a momentum as one select board after another adopts this, that the momentum carried by the weight of these resolutions in from various select boards in various towns will bring pressure to bear on our legislators to act in a decisive manner to intervene. So I would urge you all to not be afraid to take up this challenge. We are prepared to help you in any way that we can, and we think that you will be successful. So thanks for your efforts and your attention, and carry on.
Okay, thanks, Jack. And so now we're going to move on to the next part of the presentation, which is about the vision and fulfilling Vermont's promise.
So what I'd like to do now is talk about sort of two aspects of this initiative. The Select Board initiative is not asking the Select Board to weigh in on any particular bills. It's not asking the Select Board, and we'll get to the current Vermont law in a few minutes, but it's not asking the Select Boards to weigh in on a solution. It is simply sounding the alarm bell. It's saying, here are all, whereas, here are all the crises that we face in the Vermont healthcare system. Here are the ways the Medicaid cuts are going to turn our crisis into a worse crisis. And we call on our legislators to do something to address this, both immediately and also for looking for more systemic solutions. But it doesn't advocate for a particular systemic solution because, that's not really the role of select boards. And also, we don't really think select boards are going to pass a resolution that says, pass this bill, right? So that's the select board initiative. And that's very, very important because our legislators obviously are aware there's a healthcare crisis, but somehow or some way, healthcare somehow gets, they keep kicking the can down the road. So, for instance, this year they dealt with education. Yes, education is very important, but actually one of the causes of education costs, high education costs in Vermont is healthcare, right? So, it's at the bottom of so many things. And hearing from many select boards, we think would be a very good way of communicating with the legislators because they're a different group. They represent towns. Why would they weigh in if they don't think there's something important and sort of a crisis going on? So that's the select board initiative. Now, Mike has already mentioned that, current Vermont law says, as we see, that Vermont must ensure universal access to and coverage for high quality medically necessary health services for all Vermonters. Obviously, we're not doing that yet, but that's our law. Systemic barriers such as cost must not prevent people from accessing necessary health care. And indeed, in 2011, we passed Act 48, which is a roadmap to publicly financed universal health care for all Vermonters. Now, you might say, well, how can we afford that? And actually, publicly financed universal health care would be much better, much more affordable, because you cut out the middleman, you cut out all the paperwork, and also people who would be covered and be covered get to their doctor sooner. They wouldn't put it off because of high copays and deductibles, and their health issues would be addressed before they were even more expensive. Now, how do we get there? Well, one way to get there would be to phase it in, because doing the whole thing all at once has proved to be a difficult political barrier for our legislators. However, we have a bill now in that, and actually we always have iterations of this bill that have been put forth that would phase in universal health care, starting with primary care. And the beauty of that is primary care is under 6% of total health care costs, and yet having universal access to primary care has been shown to be the single most effective measure in improving population health. This has been, proven in studies. So we have a bill now, H433. It would phase in universal health care, starting with publicly financed universal primary care. Now, that's something that we would like to advocate for. But again, this is to be separated from the select board initiative. So one is sounding the alarm bell, and the other would be to try to push for this. And, there's so many examples you could give of primary care and why it's so important. Routine blood work, for instance, can discover, if somebody is going to have diabetes, ward it off before they have it. All kinds of other things are obviously discovered not only in your yearly checkup with your primary care doctor, but also it's the place you go when you notice something has gone awry or you feel sick. You go to your primary care doctor. So that's why it's so important. And as they say, an ounce of prevention is worth a pound of cure. So I'll stop there, but I did want to make clear that these are two separate but related initiatives. So select boards, sounding the alarm bell, and then advocacy later for universal health care, starting with universal primary care.
Okay, so thank you, Ellen, for that summary of where we want to go. And now we move to the final part of the webinar, which is on getting your group started. So it doesn't take a whole lot of people. In fact, we recommend that you start with 2 or 3 people. If you already have a small group that is working together, then that's fine. That is something you might want to continue with. If you don't, we recommend you reach out to 1 or 2 other people who feel passionate about the healthcare crisis we're in and want to do something about it, want to feel that they're making a difference and are in fact making a difference, and start working with them. And we have put together a guide for mobilizing your community to protect health in Vermont. I want to go over this guide with you very briefly right now to explain what's in it. There is, in the description below this video, there is a link to this particular guide, which you can get and use on your own and download. So let me just go through that now. In the guide, you will see that there are several hyperlinks, and if you click on those, you get more information. And for example, if you click on the House budget bill here, that brings you to a page in the Kaiser Family Foundation set of resources. And this particular resource gives you very detailed information about how the budget bill works with respect to healthcare, healthcare issues that we've been talking about. So that's one of the resources. If you scroll down here just a little bit more, we've put a link in here to Damon Centola's book, Change: How to Make Big Things Happen. This is not something you have to read, but it is very useful to understand if you want to get a big picture of how to make social change happen. This is based on about 25 years of research in network dynamics, and is a culmination of Damon Centola's own research. It helps you understand the big context of how this sort of change that we're looking to make takes, how it works, and what you can do to help move it forward. And then we have in the guide 6 steps for how to get started. The first step is to get yourself informed, and that's about learning about the national picture, which we've been talking about, as well as the Vermont impact and the local impact in your particular community. We've put together a collection of resources, which we're calling the Little Seed folder of templates and other resources, and that's available online in a Google folder. All of these documents here, if you click on that link, you get this folder, and all of these documents are in that folder. So this is a video on how Medicaid cuts would devastate healthcare. It gives you some background into how the Medicaid cuts are going to have an effect on all the states in the United States, but particularly states like Vermont with many rural hospitals. So as we go through the guide, there's information on the Supplemental Nutrition Assistance Program, and there's Vermont-specific data with links to Hunger Free Vermont, Vermont Food Bank, and so forth. Step 2 is to build your community coalition. You can't do this alone, and what we've said about how we went about trying to get this resolution passed by the Middlebury Selectboard applies as well to others. So we recommend getting in touch with healthcare professionals, building a relationship with them, talking to other people in the community, in faith communities, in service clubs, business owners, getting acquainted with how people are experiencing healthcare, what problems they perceive, and how they think the cuts to federal funding of healthcare in Vermont could affect them. There are some personal stories that we found were very effective and powerful. I've included a link to Jack's 12 Brown Eggs article, which was published in the Journal of American Medical Association, called 12 Brown Eggs, and you might want to read that. It's the more extended version of the story of Brian and his meningitis that Jack related earlier in the webinar. So you want to also get in step 3, engage your select board. That involves getting acquainted with your town's website, getting acquainted with who's on the select board, how the select board works, how matters are put on the agenda. Different towns have different procedures for how things get on the select board agenda. In Middlebury, you go through the town manager. In Cornwall, for example, you just send a note to the chair of the select board. In your local select board, it may be different. And you want to give them information that will help them understand what you're talking about. So a 1-page fact sheet with key Vermont data would be helpful. One of those is included in the folder I mentioned just a moment ago. A fourth step is to leverage your local media. So before you have a meeting with the select board, you might want to get in touch with the local newspaper and a reporter to alert them that this will be on the agenda. You might also want to submit letters to the editor, to your local newspaper. And certainly if and after the resolution is adopted, you want to send a press release to various outlets, not only your local newspaper and radio station, but regional newspapers, VT Digger and 7 Days, and so forth. And then step 5, after the resolution is passed, you want to say thank you to the select board, confirm that the resolution has been forwarded to state legislators and the governor's office. And then if the resolution is not adopted, don't be discouraged. Understand why this happened, regroup and re-strategize. And finally, step 6 is moving to universal health care in Vermont. And we've talked about Act 48 and its requirement that Vermont must ensure universal access to and coverage for high quality and medically necessary health services for all Vermonters. The initial phase of that will be moving to universal primary care, and that's part of the thing that you would want to keep on your horizon. So thank you very much for participating in this webinar today. Please take advantage of the links below that are in the description and get in touch with us. We'll be happy to help with any questions. Thank you so much.